You're watching CTOM TV. Knowledge is power.
So how about refractory? And this is really what most of the people call us for, refractory NHL. So in this particular combination, rituximab, as you recall, it's a CD20 target, monoclonal antibody, was combined with a drug called lenalidomide. Now, I'm sure many of you recall thalidomide. That was the drug that was banned back in the 60s, in the 70s, and so on. I believe it was a problem that caused birth defects. Since then, it's been repurposed and it's been altered. And lenalidomide is a derivative of thalidomide. There's also pomalidomide, which is another derivative. And they're quite effective in non-hodgkins lymphomas and some other diseases. So in this case, they looked at relapsed or refractory follicular and marginal zone lymphomas. And they found that the progression-free survival hazard ratio was 0.46. So a hazard ratio basically means what is your hazard of getting the disease back or dying? And so the progression-free survival hazard ratio is what is your chance of having the disease come back? And in this particular case, when they used this combination, they found it was 0.46. So to determine what that means, you have to consider that 1 is no change. Higher than 1 means that it didn't work very well, and lower than 1 means it did work well. So in this particular case, you would take 1, you would minus 46, and that would be the size of the reduction. So that would be a 54% reduction in the disease coming back with this combination. And that ranged from 0.34 to 0.62%. So some patients it was 0.34, others it was 0.62, but the average was 0.46. In this study, they looked at the duration of the progression-free survival, and the progression-free survival was 39.4 months. The range was 22 to not reached. Not reached means during the course of the study, those patients still hadn't had their disease come back. So in some of those patients, their disease still hasn't come back. And that was compared to only 14.1 months for rituximab alone. So that's a significant difference. So combining, simply adding lenalidomide when you have relapsed refractory marginal zone lymphoma makes a huge difference. You know, 39.4 months versus 14.1 months for rituximab alone. Huge difference. So definitely consider that if you have this circumstance. You can go to the next slide. So now we're going to get into some targeted therapies. So one of the new targets that they've looked at in refractory follicular lymphoma is something called an EZH2 mutation. So in patients that have mutations in their EZH2 gene, there's a drug called tazemetostat. And this is an EZH2 inhibitor. So it's a targeted therapy. So it's FDA approved. So in patients that had refractory or relapsed follicular lymphoma, and they had these mutations, they had what's called an overall response rate of 69%. So basically what that means is if you have 100 patients in the trial, over 69 of them responded to this drug who had that mutation or had one of those EZH2 mutations. And that ranged from 53 to 82%. So at the best of cases, in the healthiest patients, 82% had a response to this drug. Now, not everyone has an EZH2 mutation, so they also looked at patients that didn't have an EZH2 mutation, and they found even in those patients, it was somewhat beneficial. And so the overall response, so someone who doesn't have an EZH2 mutation is referred to as wild type. Wild type means you don't have a mutation. So even in the wild type, it was still 34%. Obviously not as good as 69%, but that ranged from 22 to 48%. So definitely, if you have this, you want to check and see if you have an EZH2 mutation, and that would be done through tumor DNA sequencing. So one of the newest advances that we know about in targeting of non-Hodgkin's lymphomas is there's a significant activation of the PIK signaling. This is one of the pathways that is fundamentally mutated in cancers. It's mutated in most cancers. And in this particular case, there's certain types of pathways of PIK signaling. They're called sub-pathways that are specific to this type of cancer. In breast cancer, it would be the PIK alpha pathway. In non-Hodgkin's lymphoma, it's the what we call the delta and also the beta pathway. So in this particular case, they had a drug called umbralisib, which is a targeted therapy for mutations or alterations in the PIK delta pathway, and the CK1, which is another gene, ellipson pathway. And so this drug is FDA approved. It's approved for relapsed and refractory indolent marginal zone and follicular lymphoma. And so in this case, they had a response rate of 47.1%, but tumor reduction occurred in 86.4% of patients, which is very beneficial. So another drug that targets the PIK alpha and PIK delta pathway is a drug called copanlisib, and it's approved for relapsed follicular lymphoma. So in this case, the overall response rate was 58.7% of patients with relapsed disease, and the range is 49 to 68%.
Thank you for watching CTOM TV. Subscribe below and stay informed.